Hello, Fiona.
Hello, how has your conference been?
It's been really good, thank you.
It's
How
good.
have you gone? Because you're in charge of the Advocacy Tree here at the Big Serve conference.
I am. I'm one of the consumers who's involved in this project. It's a catchment-based planning project based with the Northwestern Region Mental Health Community Support Services, which is always a mouthful. Basically, we were brought together to help the service providers identify gaps in mental health service. We discovered through conversation that advocacy keeps coming up as a key area where consumers need assistance, particularly how we can help them advocate for themselves, how we can help them navigate their own journeys in the system and give them some power back. So in order to do that, we have devised our consultation method, which is our Advocacy Tree.
So we're going to have a quick look at that. So we should look first at that poster, should we?
So
Or we'll look at the question.
you can look at, we can go from one to the other.
So there's that question. What would a consumer need to be able to advocate for themselves in the current climate?
So the questions are prompts to help people think about the issues. The branches of the tree are areas of the mental health system where people have talked about where advocacy is needed. The tree itself is a metaphor. We treat it like the system is like a map. There are many branches of it, but in order for the system and for the consumer to be able to survive, you need a solid base, you need good roots, and you need nourishment. So the tree is our metaphor for if a consumer is to be able to stand supported, we need nourishment, we need support, and you need to be able to understand what all the branches are.
So how's it been going here then? What's the interaction been?
It's been very interesting because the majority of the people here are providers. So we've been asking them to think in terms of the consumers that they work with. Okay, from their perspective, what have they seen that would be helpful for the consumers that they work with? What is their lived experience? They might have been working in the industry for 40 years and they've seen a lot and say, you know what, this would really help a consumer. I've seen this work. So we've been asking them to think outside the box a little bit, put themselves in consumer shoes, and today it's been fantastic. A little slow yesterday, but everyone's enjoying all those presentations. Today, people are thinking and they're communicating with us, and that's what we need.
And do you want to point out anything that people have put here?
Yeah, here's some examples. So each colour has a different meaning. If it's red, it means this is a really significant issue. This is of high importance. So this person has told us that the clinical staff are simply ignoring mental health act principles. So this is something that has to really be looked at. This is a great one. This green means this is working, this is great. And this person has said peer support workers in outreach, keep it up, more. And then we had another one, where was she? This is just, it's not a specific problem or concern, just stating a bit of wisdom that unified collaboration and advocacy creates strength for the whole sector. This person particularly would like to see all aspects of the sector working together towards helping the consumer.
And now what will you do with this beautiful tree?
Okay, so as pretty as the artwork is, it is actually a research tool, and we take it back. We've done one before. We will gather the data, collate it. We haven't decided our methodology yet. We're letting the analysts and that do all that wonderful stuff. And we'll have a look at it and hopefully get some key themes and areas, and then we can use them to hopefully direct us into what we can actually start putting into a mental health advocacy tool.
Fantastic. Fiona, thank you very much. I'm so sorry we had to rush it because we ended up squeezing it in.
That's fine. The end of the
last few
day
minutes.
has been the best part of the day. It's been wonderful. So you've came at the best time.
Thank you.
No worries. Thank